What are we doing here today?
Well, today is our embryo transfer day.
We are totally excited about that. You definitely meet our criteria to just do one. And we do have 4 others that we want to freeze today. So, you know, we can always kind of do 2 at a time for those if you guys want to in the future.
Yeah, we're thinking one for now.
Yeah,
because,
totally.
we don't really like the risks of having multiples.
Absolutely.
We want it like go full term.
Right.
So yeah, look, this is our embryo.
Yeah.
So that's a good grade.
Yeah, it definitely got the highest score that we give. Good, out of the good, fair, poor.
It's like a tadpole.
Yeah, I know, it's kind of fun. What we look for, the most important thing is what's called this inner cell mass, and that's kind of this little nugget over in the corner here.
Oh wow.
And that's what actually forms the fetus later on in the pregnancy. So we look at that area to make sure it's compacted together. And then the area surrounding that is called the trifectoderm, and that's what forms the placenta later on. So we look at both of those components to give it that grade. No, well, you get to keep that, which is kind of fun. So the other 4 look a lot like that, and those ones will be frozen today. And then we have 5 more embryos that are kind of maybes for freezing tomorrow. What we see is sometimes embryos just take 1 extra day to get to this stage of development.
So it's not like this, it's maybe like
Exactly, yeah, they're kind of more at this intermediate stage. And again, nothing concerning, but it just means that they need 1 more day. So we'll make that final decision about those ones tomorrow.
But there's still 5 that were good though, right?
Yeah, so we have, as far as good, fair, poor, let me see what we have today. 1, 2,
And then the 3 didn't make it.
Yeah, exactly. There are 3 that will be discarded, and those ones are arrested. So we freeze anything that's good or fair quality, essentially, as long as it has that inner cell mass.
So out of 13, 3 were bad, 5 were
Like
prime
this?
condition.
Yeah, exactly. We have the 5 today, and then 5 more maybes for tomorrow, and then
Okay.
3 that are arrested.
Okay.
So definitely a really good.
Well, yes,
spread.
we're just going for 1 today,
Yeah,
so you know.
absolutely.
But if it doesn't work, we'll do 2.
Right, yeah, and it is nice to kind of start conservative. As far as kind of what we see from our pregnancy rates is that it really doesn't benefit you to add a second one, because you're right, when you factor in the risk of multiple pregnancies, it's definitely better you have better chance of live birth with just doing 1 embryo. So.
You don't want any complications or
Yeah,
anything.
it's nice to avoid if you can.
Yeah.
Nice and easy. So,
Do you know how long before we can test for pregnancy? I know it's October 16 is our beta, but
yeah, that's pretty much it. I mean, you can ask Liz about. I mean, some people obviously you're really like nervous up until then, and some people kind of cheat and take one of those home pee tests, but they're just not super accurate until that point, and so you can't really like get yourself too worked up in either direction, whatever the results of that would be.
yeah, so just keep
but I mean, you're allowed to if you want to, but you definitely want to do that beta no matter what.
And I
because
am
that's the most accurate way.
and I just caught a flu like right after the egg retrieval.
Yeah.
So I don't know.
confusing.
I don't know if that's gonna affect.
It shouldn't. I mean, yeah, it's that's kind of inevitable, obviously.
Yeah.
We always just recommend kind of relaxing for the next few days anyway. We don't really want you to have a really like that.
I'm just so happy with our embryos.
Yeah.
Oh my gosh.
I'm excited that it turned out so good. I was really thrilled to hear that you guys wanted just 1.
Yeah.
I mean, I always joke like, oh, there's your twins. But really, it is very high twin.
Yeah.
We do 2 that
Yeah.
are high quality. So.
That's what I'm saying. Like if we put 2, like
If we get lucky on the first poll, you know, we get the 1 kid.
Totally.
We can always come back for a second one.
Mm-hmm.
But if it turns out that the first one is a no-go, then
we'll do 2.
Yeah.
Right, and that's definitely what most patients, how they approach it, I think.
And I know this is, I mean, yes, I want the most healthiest kid possible.
Right.
Any chance of us knowing if it's a boy or a girl that's being inserted?
Not right.
It's 50-50.
Oh.
Yeah. For these, I mean, we know that kind of when you look at the morphology score that we give, the highest quality embryo is going to be the most likely to be genetically normal, but it's never a guarantee, and that's why it's not like 100% pregnancy rate ever.
But we have a good concern, like there's no like Down syndrome or any of that type of stuff.
I mean, you're kind of in that lower risk category based on your age,
Okay.
And so it's typically not, the risk of having an affected child like that is low enough that there's really not a huge benefit to doing the biopsy on the embryos and freezing them and thawing them and extensively.
I just have a question.
Yeah.
So out of the 15, all of them were ICSI?
Yes.
Oh,
well,
okay.
just 13 of them. So what we do is we clean off the outside cells on the egg, and then we look to see if it's mature. So only an egg that is mature at the right stage of development will be able to accept the sperm to be fertilized. And inevitably, when you retrieve, a dozen eggs from the ovaries, not all of them are going to be mature. So in this case, 13 of your 15 were able to receive the sperm.
But you're saying for the other 5, they're like this. They look like this, not day 4 or 5.
Right, yeah, they're either this or somewhere in between. So basically, the cells are still dividing and they're kind of compacting together, but it hasn't really expanded enough for us to see that inner cell mass feature. And like I said, we want to see that to know it has potential to make a viable pregnancy. And so we really wait till we can see that piece to want to freeze it, because otherwise it's not really worth your time. So, yeah.
Okay, thank you.
Excellent.
Okay.
All right, I'll take a peek at your wristband. Obviously, the most important part of the whole process. And you guys
Then make sure that's my embryo.
Yes, it definitely is. We take it very seriously and look lots of times. And you guys will also get to see your name up on that screen there. Your name is printed on the top of the dish that your embryo is in, so you'll see it before I load the catheter. So,
Oh wow, okay.
yeah, it's
Is
kinda
this
fun.
what we're gonna be looking at too?
Yeah, exactly. You'll get to see it. And this
Oh,
is
over there too.
yeah, you'll watch it. This is your bladder up here, this black portion. And the catheter will kind of come in as a white line from the right side here. I feel like I've done nothing to make you uncomfortable, so I'm glad that helped.
It's just that I have so much progesterone
Oh, yes.
discharge.
And that is not unusual.
Curved. I have to go that way.
So,
Okay.
that's why I do. Okay, so, Guevara, is that the way you pronounce it?
Yes, that's
Technically, it's Williston, but she never changed her driver's license. So
781. And the color's magenta.
yeah, that baby's gonna be a Williston.
Well, I have to
This is
wait.
embryo.
Oh, there we go. All right, there it is. Looking great. Okay, going to the catheter now.
There's the embryo.
It's gorgeous.
Yay.
Applauding
You're all admiring it.
and saying, thank goodness you're not transferring too.
Yay! And it's in place. It's in. Oh my gosh! I'm gonna cry. Thank you.
And then it's like 2 weeks, and then we get to do a pregnancy test.
9 days. There we go.
Yay!
Just didn't want to advance until I had it all the way connected. Okay.
Shall I measure you there? Okay. So you are here. The top is there. That is 15.
Okay.
We'll go live here.
I feel it.
Do you feel that?
Yeah.
I'll use that while I was
Just a
pushing
little-
that a little
You
bit.
saw that little tiny bit of movement, so that was just as I injected. So, now I'm just going to very slowly withdraw. I'm just going to take the
Okay.
out.
Oh, okay, but it's close, right? It's a.
Yes, yeah, that's exactly where the tip was when we injected.
Thank you so much, doctor.
Okay, you're welcome. You did great.
Thank